All right, ladies and gentlemen, welcome to APAC Roadshow by Focus Point. My name is Kay. Today joining us, we have Miss Chia. All right, we are so happy to have Miss Chia joining us today to share with all of you diabetes and your eye. Miss Chia, over to you.
Okay, thank you, Kay. My name is Chia. I'm from Focus Point. So today our topic of interest will be diabetes and your eye. We will discuss about diabetes and also how it will affect your eye. So allow me to introduce myself. I'm the head of training and development from Focus Point. So I'm an optometrist by training. I graduated from UKM many years ago. So I've actually done a master's degree with UKM as well. So after finishing my master's, I was actually lecturing with SAGI and UCSI. I did training with Bosch and Lomb for about a year, training for Bolton Optical Group for about 2 years, and also I volunteered in the Association of Malaysian Optometrists for about 5 years as their secretary, as their organizing chairperson for seminars, and also as their newsletter editor. So that's a bit about my background. So moving on to diabetes. So diabetes, we have two types. We have type 1 and type 2. Type 1 affect the younger generation between 10 to 20 years old. So it's actually a lack of insulin, a type of hormone that regulates your blood sugar. Whereas type 2 is the more common type, is an acquired type. We normally find it in those that is more than 30 years old. So it's an insulin resistance, means the insulin is not functioning very well. The cells are not reacting to insulin, and there is a failure of glucose uptake by the cell to reduce the blood sugar level. So of these two, the type 1 will need insulin jab, whereas the type 2 will need an oral hypoglycemic agent, which is oral medication, the tablets. So if we actually look at diabetes, what are the signs? So you will go to toilet more often for you to urinate. You feel more thirsty, maybe in the morning when you wake up. You feel increased hunger. Other things are like you feel easily tired, malaise. You have a longer healing time for wound and cuts. Weight loss, blurred vision, and also genital itching. So generally, these are some of the signs and symptoms of diabetes. So to diagnose diabetes, we have several criteria. First criteria is blood test. So at any time when you test your blood, if it's 11.1 millimole per liter of degree, then you'll find that you have diabetes. A fasting blood sugar is what we normally do. We fast throughout the night for 8 hours. Then in the morning, we go for a blood sugar test. That one is below 7 is the normal value. Then whereas, that is the common ones. So 11.1 or 7 for fasting. So we also have another thing called HbA1c. Nowadays, if you go to a doctor, you find that the doctor will actually talk about this. So they will ask you to go back, like if they change your medication, then they say 3 months later, come back and see me, we do a HbA1c. So this is something like an average blood glucose across 3 months. So this one, the normal value is 6.5. Anything lower than 6.5 is normal. Anything higher than 6.5 is abnormal. So I'm also a diabetes patient because it runs in the family. So my HbA1c is not good. It's not below 6.5. It's slightly higher. So the doctor is still trying to adjust my medication. So what are the side effects of diabetes? It affects actually the whole body. So first, diabetic retinopathy is the eye. So it will cause changes to the small blood vessels of the eye, and there start to be leakages and formation of new blood vessels. There's also nephropathy, which is kidney failure. Diabetes can also lead to kidney failure if poorly controlled. We also have higher risk of stroke with diabetes. So with diabetes, you get 2 times risk. And also cardiovascular disease, heart problem. There is actually 2 out of 3 deaths associated with diabetes in heart diseases. Then lastly is neuropathy. So our nerves become less sensitive. So when we relate this to the eye, what you get is dry eye because our nerves becomes less sensitive. So the stimulation to produce more tears is reduced. So most of the diabetes patient will sooner or later end up with a bit of dry eye. Yeah, so
that's a
these are some
relationship.
of the effect in the whole body. So the diabetes effect is actually quite big. So prevention basically is losing body weight and also exercise. So we have to lose 7% of our body weight. Okay? And then we have to exercise 30 minutes a day for 5 days a week. So it can be brisk walking. Doesn't mean you have to go jogging. So these are the ways to actually prevent diabetes.
Even for them, if they are like walking in the mall, that's considered too, right? Like brisk walking in the
Yeah.
mall.
Can lah.
Some of the modifications that you can do to the lifestyle.
So, I think shopping is one of the things we can consider doing. It's actually easier to do. Yeah. So prevention of diabetic complications, maintaining a good glucose level. So this is HbA1c less than 6.5. And then fasting blood glucose less than 6.1. Actually, it's less than 7. That's just a range. So then control your blood pressure. So controlling the blood pressure doesn't mean that you have to lower down your blood pressure.
Oh.
You can also take medication because we cannot lower down the blood pressure without the medication. So you can also take medication, meaning the suitable medication to to lower down your blood pressure.
All right.
Then control your cholesterol level. Also can take medication. Stop smoking, very important. Yeah. And also again exercise. So
Yep.
this is to control the complications from diabetes. So exercise like just what we mentioned just now, 30 minutes for 5 times a week. So and what Kay suggested is maybe we can go shopping for a few hours. So it may work the same like brisk walking for 30 minutes.
It's like window shopping.
Yeah, and losing weight, bringing your BMI to the normal level.
All right.
So the other thing we can do is to eat healthily. So we need to eat a lot of fruit and vegetables, cereals, and also fatty fish. So these are components of a healthy plate. Okay. Then risk factor of diabetic retinopathy, how can it go into the eye? So one is a poor control of HbA1c. Just now we mentioned the normal value is below 6.5. This is your blood pressure, your blood lipid, and also your weight. So these are all the things that was covered previously. Just now in the previous few slides, we mentioned have to lose 7% of your weight. We also mentioned have to take medication, lower down your blood lipid, and also your blood pressure. So these are all covered in the previous slide. So why do we want to talk about this topic? It's actually quite important because if you look at the overweight adults in ASEAN region, Malaysia is actually number 1. Yeah.
Malaysia ranked number 1 in this.
Yeah, in the overweight population.
All right.
So, and also why are we talking about diabetic retinopathy? Because if you actually look here, we have cataract as the main cause of vision loss. Number 2 is diabetic retinopathy in Malaysia. So it's actually causing vision loss in a lot of people in Malaysia. So that's why it's something we should pay attention to, and we should get regular checks, your blood sugar and also your eye.
All right.
So screening, generally if you are type 1, meaning is born with it, the lack of insulin type, that one you need to screen 5 years after first detected. If you are second acquired type 2, then you have to screen at the point of diagnosis. So meaning once you know that you have diabetes, you have to go to check your eyes already. Yeah, so that is that. So if you check your eyes and you're normal, you can check every 2 years. So this one we are referring to the back part of the eye retinal screening, the fundus screening, station number 4 in our eye test routine here.
So in other words of saying, if we do the test here, we can kind of like know whether we have it or not?
Yes.
It's like an indication whether we have diabetes or not.
No, whether we have diabetic retinopathy. Whether the diabetes is in the eye or not.
Okay.
So then what is the gold standard? Gold standard is a fundus camera, non-myodratic fundus camera screening. So this is station number 4 there. So we are actually doing this test for all of you. You can just register after lunch later and we can actually do the screening for you. So if you have diabetes, it'll be very useful. So this is a picture of diabetic retinopathy eye. We have formation of new vessels, we have hemorrhages, bleeding, some leakages, and also abnormal blood vessels. So this is how it looks like. It can look really bad. Yeah. Okay. So what happened in diabetes? Why do we have all these changes? So generally it's capillary, the small blood vessel changes and the blood changes. So this will actually lead to leakage and occlusion. So leakage from the blood vessels and occlusion of the blood vessels. So this will lead to a poor supply of oxygen and we will get new vessels. So new vessels will grow. So then if we actually look at capillary changes, we have loss of pericytes, proliferation of endothelial cells and basement membrane thickening or damage. So all these are changes on the vessel wall. So these changes on the vessel wall will actually lead to leakage and also occlusion. Okay, occlusion is blockage. So other things that happen is loss of tight junction. So this can also lead to leakage. So the blood vessels generally become not healthy and the fluid start to leak out. Sometimes there's bleeding when there's an occlusion. So these are some of the changes that you can see. This is also the normal and the abnormal changes. We can see the capillaries are dilated, it's like fatter. Then the blood vessels, the blood will also change. There's a rouleau formation, so it stacks and also it crumples together. So this will actually cause deformation of the red blood cells. So all these will actually stick and aggregate together and this will cause poor blood flow. So poor blood flow will lead to poor oxygen supply. So this is actually the blood changes. So when poor blood supply, there will be lack of oxygen, hypoxic. So then what happens is there will be a growth factor. So this will stimulate more growth of new vessels. These new vessels are very weak and very easy to burst and lead to bleeding. So that's why you see new vessels at the retina, which is possibly diabetic retinopathy, optic nerve head, diabetic retinopathy, and also new vessels at the iris. This part here, you can see some blood vessels growing. So these are some of the changes in the eye. Yeah. So this will actually affect the patient quality of life. So you will actually see patchy vision. You find that your vision loss. Yeah, so it will actually affect your social interaction, daily activity, cannot read, and then you have to take a lot of medication, maybe you have to take the jab, maybe your wound on the foot cannot heal, and then you want to exercise also because you're overweight is difficult already. So this will actually affect your quality of life as a whole. So it's very important to control your blood sugar, your body weight, your hypertension, your blood lipid level.
I think not just physically, right? Like mentally, it will affect our emotions too.
Yes, if you cannot see, it will definitely affect. So this is a video from Focus Point. Actually, to end, I actually want to encourage everyone. If you have diabetes, do have eye check at least once a year. If you haven't checked before, you can check here. It's free. So we have 8 steps. This is step number 2. Step number 3, binocular vision test. But for diabetes, the more important is the latest step, which is the retinal screening. So we also have power check. In diabetes, what happens is if your blood sugar is high, your power will be fluctuating, not stable. So it will cause sometimes your vision blur, sometimes your vision clear because the blood sugar. So it will cause some swelling in the eye. So this anterior eye assessment is also important because in diabetes patient, the cataract will come earlier. The dry eye will also come. Eye pressure. And lastly, retinal screening, which can actually detect the bleeding in the eye if there's a diabetic retinopathy. So lastly, we will conclude with a consultation session to sum up everything. So this is what we have in our 360-degree APAC outlet. So, and these are some of the tests that we will do, what we have in the roadshow now. So you can visit, we have more than 85 outlets, about 87 to 88 outlets. So you can visit any of our APAC outlets to get the full checkup free. So do make an appointment to see our qualified optometrist. We are having more than 190 optometrists now in Focus Point Group. So thank you very much for your attention.
Thank you very much, Miss Chia, the big hand. Thank you very much for the sharing. So any special last words for them, if they are like still listening, you know, anything, take home notes?
I think all this is a lifestyle disease. So we need to have a healthy lifestyle, eat healthily, maintain a healthy body weight, exercise lah. I also have to do this lah. Yeah, it's also important for me. So because like diabetes, hypertension is all a lifestyle disease lah. So we have to maintain a healthy lifestyle lah. That's what I think lah. Yeah.
But it's happy to know that if we know that we have that disease or maybe we are being diagnosed, it's treatable if it is still in the early stage,
Yeah, it's
right?
treatable and preventable. Yeah.
So have no worries, we are here with you, hand by hand. Let us know if you need any assistance from us. We are more than happy to help all of you.
Yes, Kay is absolutely right. Yeah.
All right, thank you very much, Miss Chia.
Thank you. Thank you.